Yay. There is some space up front here too if we want to sit down. This is actually really amazing to see so many wonderful faces, to have my students here, and I believe 5 other classes, right? Wow, look at us. Welcome everybody. We're going to start with Jamie Austin, the head of the gallery space here, just to say a few words, and then we'll go from there.
Thanks, Chris. I'm going to stand at the podium. All right, hi everyone. Welcome to the CCA Campus Gallery. This is here for you. Right now we have the CCA faculty exhibition called Stories of Us that's up right now. So there's work by 62 faculty who teach at CCA all around you. There's writing and sculpture and painting and drawing and industrial design and all of the different practices. So hopefully after this event you can peek around and look a little more. This exhibition is actually open until October 20th, so you have one more week. And we are open Wednesdays 11 to 7 p.m. Thursdays and Fridays 11 to 4 if you'd like to come back. We also have upcoming exhibitions by Fine Arts seniors that will be here and a CCA staff exhibition to round off the semester. So thank you for being here. Stories of Us is part of our Creative Citizens in Action initiative, which if you haven't heard about is a college-wide initiative that's focused specifically on democratic engagement and creative activism. And we do have opportunities to support student work. We support faculty participation in our public program series, the Creative Citizens series, every year. And then we're happy to also support events like this. So this event is supported by the Deborah and Kenneth Novak Creative Citizens series funding. And thank you for being here for part of that. So CCA at CCA supported Chris's work, and then also the event that we're here so that we can bring interesting people here to interact with all of you. So thank you. You can stand in front of the art on this side of the wall if you need a slightly better view, or you can kind of filter a little bit in front of the doors. I think we've set a new record for the number of students in the gallery space. So let's clap on that one. Yeah, so go first year program. We appreciate that. So thank you for being here. I'm going to throw it back to Eric.
And, I'm going to pass this off in just a second, but just a few housekeeping things. If you are, say, against a wall, just a reminder that we're in a gallery, like it's okay to lean against that post, but if you're against a white wall, don't do one of these, where you put your foot on the wall, because then it leaves a shoe mark, and then someone's got to come through and clean all that stuff up. So just be really respectful. I want everyone to feel comfortable here, but I also want to make sure that we're not causing undue work or possibly damaging our work around us. The other thing I just want to say real quickly before we hand it back is course registration for the spring is going to be happening soon. So this is like a great visual cheat sheet for what you might be possibly interested in. And like we said, all the faculty have work here. So if you were like, whoa, I really want to learn ceramics, how could I do that? Then you would look at the faculty member's name and be like, Eric Scullin, who's that guy? Maybe he's going to teach a class. Or what's happening over here with these? Figure out who made it, and maybe you want to take a class with that person. Or anything else that's here. Like, I want you to investigate, be curious, learn things, take note of who those people are. If you're like, this is awesome, even if it's not next semester, but sometime in the future, take a class with that person. Like, it's a great way to do research and figure out what's going on. So you'll have some time to look at the artwork after this event. I'm going to pass it back over.
Thank you, Eric. Thank you, Jamie. Hello, everybody. My name is Chris Treggiari. If you don't know me, I'm a first-year faculty. I've been teaching here over 10 years now, which is a long time. And I really feel like it's an honor to teach first-year students. And it's always just really great to meet everybody and to interact with you all, and I'm excited to be here. I hope you are. Today's going to be a very dynamic event. What you're looking at right now is a piece of public art. You're good. What you're looking at is a piece of public art. It's a performance art piece. It's a piece of sculpture. It's design, right? It's all these things mixed together. It's an interdisciplinary piece of art, right? The press conference is part of a bigger project called the Oakland Lowdown. And what the Oakland Lowdown is I collaborate with a journalist, and this person's name is Cole Goins. Unfortunately, Cole is not here today, but he sends his best. Cole's a journalist, but he's also an engagement artist, and he's also a designer, and he's a musician, and a lot of different things. And Cole and I have been working together, collaborating together for the past, 10 years or so. And so this, the Oakland Lowdown, is a place where journalism and art intersect, and it's right in downtown Oakland. It's on the corner of 14th and Harrison Street. And it's open to the public. It's a community space. It's a space where we make art. It's a space for education. It's a space for making zines. It's a space where we do public broadcasts out of there with video. And it's really about making connections in downtown Oakland, right? We are part of the Harrison Hotel. The Harrison Hotel is an 84-unit SRO, which means a single-room occupancy hotel. And the Harrison Hotel brings in low-income folks that can live there with HUD, low income, they pay, and there's a community there, right? As an artist, I was asked to kind of occupy this bottom floor space, and I've been doing that for the past 2.5 years with my friend Cole. And it's been a real honor to work in that community, to meet everybody, to work with the Harrison residents, and to work with Greater Downtown. This is part of that. This goes out into public space. This connects experts. Today we have my mom, Kathy Treggiari, who I'm really excited to have here. My mom is an expert in a lot of ways. My mom just retired, congratulations. Yeah, that's nice, thank you. A round of applause, I love it. My mom just retired after, 25, 30 years of service? Yeah. So, this is a platform that goes out, gets set up, and starts conversation with people, right? In the past, we've talked about harm reduction. We've talked about needle exchange through the press conference podium. In the next couple months, we're going down to downtown Oakland, and we're talking about the redevelopment happening in Oakland right now, and who's being affected by that development, either positively or negatively. We ask experts to come, share their thoughts, and share their knowledge with us, right? It's very impromptu, it's very kind of loose, people walk up on it, and really get the chance to ask pertinent questions that they have to people that can inform us. Yeah, I think that's good. And I think today we want to talk about the unhoused in the Bay Area, right? I think this is a topic that I hear a lot from you all about, right? And I've had the real privilege and honor to live firsthand with somebody who's been on the front lines of innovation, of community engagement surrounding the unhoused, in terms of advocacy, right? Sorry about that. Advocacy, right? And I want you all to take in what this expert tells you, and then think about what questions can we ask this expert? What do we want to know? What is a question that we have that, something that we see, it's very visible. Stop doing that. It's visible, right? I've had many conversations with you all over the years about this, and today's going to be a really great chance just to dive in, okay? I think that's good. I think that's everything I want to mention. I'm going to hand it over to my mom now, Kathy Treggiari. And the reason why this is part of Stories of Us exhibition is she's my mom, and I thought it'd be really great to bring in an expert that I'm very close to and has shaped my art practice. My mom and my family has really shaped my trajectory as an artist, and as a designer, and as a performer, and as a sculptor, right? And I think that the honor of knowing just the expertise of my mom, plus the inspiration for me to create this whole world of art through that has been really exciting. So, without further ado, my mom, Kathy Treggiari.
So first of all, I'm not an expert, I'm just Kathy. Just Kathy. I want to say that I have been in the trenches for 29 plus years. In the trenches meaning I haven't been, in administration, behind the desk. Well, I want to point two things out for us.
Yeah.
Behind the desk, I always made sure that even though, I was a little bit in administration, I also had one foot in the people that we're serving, right? That's where my passion is. That's where the horror is of homelessness. But before I tell you a little bit, I just want to point out, I love this gallery in the short time I've been in here, and it feels home to me. I want to point out first this, and sorry if I get a little emotional. am I next? Black Lives Matter, am I next? In this country, we're going to talk about all sorts of hard things with homelessness, right? And we're going to try to open our minds, as I had opened mine, because I'm middle class, I didn't come from being homeless, right? So opening my minds, constantly being educated on what it is. But am I next? There is no one in this country that couldn't slump into homelessness given the right set of circumstances. So that's number one. And number two, I want to point out, I absolutely love this. Over here is a picture of, I think it's a man with a ball and a chain. And the ball is in his mouth. And it says, the weight of words unspoken. We're going to talk today, and it takes a lot of courage to talk about things that are unspoken. Things that we see around us, things that are radically unfair. Radically unfair. And we're going to talk about that. And it takes great courage for all of you to be here to hear this. And again, I'm not an expert. I certainly, in 30 years, didn't end homelessness. It's alive and well in this country, all over the country. It's alive and well in San Francisco. But we're going to sit and we're going to hear some hard facts. And it says, you know, we're all, I love the fact that you're all here. You're an inspiration to me, and I mean it. I'm 70 years old. I'm going to be 70 in December. My journey, you know, goes back. I've seen different things, right? I've seen history. I've had grandparents with the Depression. I've seen the economy change. I've seen not homeless to homeless and asked myself why. But right here it tells truth-telling. We're gonna do some truth-telling today. And it's not easy, and it's not easy. So again, I've been in the field in the Northeast and definitely here. I worked in San Francisco for 10 years. I just retired and worked another 3 in Berkeley. And so there's that piece of it. I think my background is in San Francisco. I managed the biggest shelters in San Francisco. So 334 beds for single adults on Polk and Gary. Another 200-bed shelter on 8th Street, the Sanctuary. I had the privilege of working with brighter people than me, smarter than people than me, right, on how do we end homelessness. So while I'm managing shelters, you know, I was able to be a team of opening the first navigation center in San Francisco, and it was on Mission Street. High hopes. The mayor, Ed Lee, back then, loved that man. High hopes that it was going to change things. And went on to helping other agencies, because I've always worked in a nonprofit, over at Bayview, Hunters Point, over at Barcadero, over at 5th and Bryant Street, opening up other navigation centers. So I've done large shelters, I've done navigation centers. I moved right before COVID. Out of San Francisco. I love San Francisco, but I live in the East Bay. So December of 2019, I transitioned out to a nonprofit in Berkeley, and bam, 2.5, 3 months later, COVID hit, right? And with COVID came all sorts of opportunity, all sorts of money that wasn't available for homeless folks. It's coming in, and that's going to be part of the hard conversation that hopefully we can have today. So you figure COVID hit in March 2019. By April, May, you know, we realized, hey, people were going to die of COVID. They did die of COVID. Many seniors and many medically challenged homeless folks, including seniors, were going to die if they were exposed to COVID. So over in Berkeley, had the honor of working with Alameda County and opened up 2 motels quickly. City identified, county identified people that were medically challenged, right? People that were disabled, people that were seniors, 7-year-olds, 80 years old that had been homeless, that were going to die if we didn't get them off the street. So we're able to move those folks into 2 motels, was able to open up a couple of trailer sites, and was able to open up a 4-bedroom house, and then quickly, lo and behold, federal money comes in like magic from the sky. And a lot of what I'm saying is political, and I'll get deeper into that, why we have homelessness. Magic happens, and with COVID, for the homeless, actually was a bit of a positive. More money flowed in, and with that, we were able to get those folks out of the motels and get them into what we call today a Section 8, a subsidized housing. Finally, in Berkeley, doing all that, getting those folks housed, it was like a miracle. We opened up, the agency I worked for, we opened up what's called the Hope Center, and aptly named the Hope Center, and it's the only in Alameda County, so it's across the bay, the only place where you have 4 programs. And it's unique, it's different, it's new constructions, absolutely beautiful. So we have a community meals. Anyone, you don't care what your name is, who you are, where you're from, don't care. Come on in and eat. So, you know, Monday through Friday, we're feeding, you know, kids, some families with children. We're feeding a lot of seniors that can't afford food because they're too busy paying rent or they're paying for their medication. We're serving homeless folks. Don't care, come on in and eat. And have a hot meal, and then we're going to send you home with another meal so that you can at least eat until we see you tomorrow. Also in that building in Berkeley, right in the heart of Berkeley, we have a small shelter, not a large 334 bed. We have a 32 bed men's shelter. We have transitional housing for veterans, getting those folks on their feet, and then 53 units of what we call permanent supportive housing. So that's a bit of my background. I don't know if I left anything out.
I'm just going to shoot a couple things. Can you explain to what a navigation center is, because nobody's going to know that?
Yeah, so way back with Mayor Lee, and it was back in, I want to say 2015, homelessness on the street, encampments, the public, you know, what's going on? What are those nonprofits not doing? We're giving you all this money and you're not solving it. So the response in San Francisco was a 334 bed shelter. And next door shelter, Polk and Gary, still there, but they've changed it a little bit. I had 115 women on one floor, no walls, nothing beautiful, 30 inches apart for the bed. So everyone's what I call, and this is warehoused. People are warehoused because it's cheaper to keep people in a building with as many people as you can put in there than to house them, right? On another floor, 118 men. So again, city's saying, hey, why aren't all these encampments, why aren't they coming into the shelter? Well, we're dealing with adults. There's 35 rules in the shelter. There are 2 security guards right at the door. Why would I want to live there? Why would I want to live in a place for years, because I can't get out of my homelessness? Why would I want to live there when I can live out and be free? And so the Navigation Center was born out of Mayor Ed Lee, who I adored, who said, we got to do something different here. Let's get rid of the rules. Let's get rid of telling adults what time they can eat or not eat. Let's get rid of security at the door because it doesn't feel warm and friendly. It feels like a prison. And let's try this. Let's bring encampments in together. And it was right on Mission Street, and it was a defunct 10 years it hadn't been open alternative high school, so there were trailers. And that was the first Navigation Center. And throughout the nation, people came. And it's like, oh, what is this? What is this? And what it is it's truly meeting people in their own terms, very minimal rules. It was getting people housed as quickly as we could, but engaging with them and not treating them like children. So again, after the first Navigation Center, throughout the throughout San Francisco, others popped up, like I say, 5th and Bryant, Embarcadero, I think, right as I left. I'm not sure if it's open. So again, it's a unique, low-threshold model where we treat people as adults. Who knew?
Okay, that's good. So can we talk about the homeless count a bit?
Okay, so what you'll get as a packet are going to be these 2 sheets. So what's the homeless count? Every 2 years, the federal HUD, Housing and Urban Development, makes sure that throughout the nation, throughout the country, large metropolitan areas are doing a homeless count. Now the problem with the homeless count is it's not going to catch people that are couch surfing. And in San Francisco, you could have 3, 4, 5 families living in the Tenderloin all together, right? So it's not going to count those people. Going to count people in the hospital who don't, as when they get discharged, if they have nowhere to go. They're going to count people in shelters, but it's certain people they're not going to count. So the last one, and again, this is only 2 pages. It's a really easy read, but it's really going to give you some some statistics. The last one was done January 2022. I'll talk about the San Francisco one, but the Alameda County will be in the packet. Done in 2022, every 2 years, it's one single night, right? So again, know that the count is great, but it's not truly as accurate as it could be, because it's one single night. And again, it doesn't count double up, triple up families, and it's not going to count couch surfing. So, you know, San Francisco is proud of the fact that they decreased from 2019. So another important fact is the last homeless count, point in time they call it, was 2019. That was before COVID. And then you've got the one in 2022. That's going to make a huge difference in who we're seeing, who's homeless, what resources came into the city, and what is now going away. Sort of like a tide. It came in and it's going out. So in January 2022, the point in time had 3.5% less homeless. And again, when you read this doc, it has sheltered and unsheltered. Remember, sheltered is 334 beds, 30 inches apart from each other. I don't consider that shelter. I consider that being a warehouse, quite frankly. You have a drawer under the shelter bed. But again, all of the counties, including Alameda, shelter could be transitional housing is shelter, but it's not a place that you're going to stay there long term. Some of what the demographics, who is hit the most January 2022? Latinx. So the Hispanic Latinx population, 55% increase since 2019. 55%. And Latinx is 30% of the whole population in San Francisco. So they're overrepresented as being homeless. And again, if no one stands here and tells you this, and this gets back to truth-telling, racism is alive and well in this country. Racism is alive and well in this country. Who are the people that get the apartments? Who gets moved out of, relocated in San Francisco? And there's a history of that. Everywhere, Oakland. Who gets moved out? Who gets bought up? And who moves in, right? Racism is alive and well. Systemic racism is alive and well. So who's at the count? Latinx. They're 30% of the homeless back in January 2022, and yet they're only 16% of the population. So you see the disparity. Black African American, 38% total homelessness back in January 2022, and yet they're only 6% of the total population. So right off the bat, what's going on? And it's always been that way. Asian American, 6% of the homeless, they're 37%. So again, less as far as that demographic. And white, 43% were homeless in January 2022, but they're 51% of San Francisco. So those numbers tell a story. When you read this, ask questions. There's a whole report that goes behind this, but there are reasons why people are homeless, and there are reasons why people of color are homeless, all right? So, moving on. I'm on the grandstand, it's dangerous. One of the things, and I'm just giving you some highlights, 49%, so again, we're now in the height of COVID, right? And this is just San Francisco. Over 49% of people that were counted in the count experienced homeless for the first time. Interesting, 49%. How many total, and I didn't get to that, how many total homeless the night of January, what did I say, 23rd, 2022? 7,754 people. 7,754 people, all right? And self-reported, 49% experienced for the first time. So you ask why? COVID, losing jobs, the housing market, you lose the jobs, that's it, it's all over, it's all over. Health issues, this is a killer, and this is where, because I'm old, real devastation with seniors. And you're not going to see a lot of this in here, and I'm going to explain why. When I was managing shelters at Next Door, it's only been 3 years, and in Berkeley, a lot of seniors that are 62 and older, and it's a silver tsunami. People my age, there's going to be more and more of them coming in because it's just the generation and how it is. Lot more seniors. I've seen seniors that are terminally ill and dying. I've seen seniors in shelters that are dumped by the hospital. Again, I'm telling the truth. I'm taking the ball out of my mouth and the chain, and not everyone is comfortable hearing this. I've seen seniors that are dumped out of hospitals because they have nowhere to go and they have no family, and they're dumped into a shelter. I've seen people with dementia that our staff would have to handhold every step of the way because they have no family left. So again, what you're not going to see in this report are the seniors, and the reason you won't see a lot of the seniors in this count is because COVID happened and this big infusion of federal money came in, and for someone like me in the field, it's like, holy mother of God, it takes this enormous crisis for the federal government to finally say, we need to do something. That's pathetic. That's pathetic that it takes such a crisis of so many people dying for money to start filtering in. So homelessness is very political. Homelessness is, polarized. Republicans, Democrats, it's political. And it's all across the board. And that's truth-telling. Before I finish, a couple of other things. So again, seniors, you're not going to see them in here. But again, I'll tell you at the Hope Center, I've got many people that have come in sick. In the San Francisco report, and again, all you gotta do is Google it, all right? It says in the report, and I've known this for the whole time I've worked, but in the last 20 years it's gotten to the point. Average life expectancy of an individual experiencing homelessness out in the street or in a shelter is up to 36 years shorter than the general population. When I was in shelters, Dr. Margot Kushel, awesome doctor, researches and has had years and years of journeying with seniors that are homeless. In Alameda County, she's out of UCSF, would always say 25 years. So when you see someone in the street that's 45 and they look like they're 45 to 70, it's not that far-fetched. So what we see at the Hope Center, I have a 62-year-old man in a skilled nursing facility. He made it for 6 months, but he's so sick. I have other people that are terminal, because what happens is homelessness kills you. Homelessness kills you. It kills you. The average life expectancy for you and I want to say is 70 to 75-ish. I think it's got down a little bit. Someone that's homeless, late 40s to early 50s. So when you hear someone chooses to be homeless, the hell they do. The hell they do. What did I miss?
No, that was good. One thing I do want to mention is, from talking for the work my mom does and from a lot of the work I've done, you talk to other nonprofits, when they do this point in time count, if you talk to advocates, they say take that number and multiply that by 2, right? So if you're thinking about 7,000 people, 7,000 plus people, that the point in time, remember, this is one night, a point in time, they have a group of hundreds of people that go out all across San Francisco, and they go count people, literally. Times that by 2, we're looking at about 15,000 people, okay? All right? Something else I just want you to mention really quickly, and then we can kind of break off, is you were talking about the COVID money coming in, and then the vacuum that's now been created, and that's kind of the visual we're seeing in San Francisco right now.
And before I go there, so the city of San Francisco, and again, fabulous report that goes along with the 2-pager. And again, it's worth a read. Anyway, San Francisco, city of San Francisco estimates 20,000 people experience homelessness in a full year in San Francisco alone. For every household that is housed, there are 4 households that become homeless. Think about that. So it's like there's this tsunami coming in of people that are homeless. And then in the report, I love this, I'm on a roll now. I thought I was going to be nervous, I'm not. I love it. People, I would hear it my whole career. Oh, people are coming in the city because they got clean sheets. It's like, what are you talking about? You look at the 2-pager here. Residents prior to being homeless, because you hear it no matter where you go. You hear it in Alameda County, you hear it in Berkeley. They're no friendlier to the homeless in San Francisco. 71% of the people asked during this count, I lived here. I lived here my whole life. I just got gentrified out of here. Or I just lost my job because of COVID. So what was magic about COVID, and COVID was hell, what was magic is the federal government, and this is highly political, and hopefully no one's going to yell at me, but the federal government infused money through the state, infused money through the counties to, hey, we're going to do something. People are dying. We just had at the MSC South, 100 people catch COVID. God only knows how many died, because I was out of the city by then. I've had people that died from being homeless, but also from COVID, right? So all this money got infused in, and in San Francisco, as in a smaller way, Berkeley, all of a sudden, and again, Mayor Bree, you know, I know that it's highly charged, highly political. It's like, what are you going to do to get them off the street? What are you going to do? What are you going to do? So they took motels throughout, all over San Francisco, with the money that came in federally, right? And they gave people apartments, not crap-ass shelters where you're 30 inches apart, their own room. Yeah, it was an SRO, but it was at least a way to live. Then what you see in June of 2022, oh, the federal money is drying up. Whoopsie, we're gonna get some of those, we're closing down some of those motels. So if you're seeing people at the Civic Center, if you're seeing people all over the street again, more so than a year ago June, there is a reason for it. There's a reason for it. And the last thing I'll say, and my career has not been, I've done innovative stuff, but I certainly haven't, I don't look at myself as a thinker and an earth shaker of ending homelessness. I have not seen that, I will not see it. I will tell you this, there's reasons why for it. There are reasons why. Deinstitutionalization in the 70s, when you're seeing crazy Kathy, that's me, out here in the middle of the street and you go, what's going on? Well, I'm not saying the institutions back in the 70s or 80s were any better, but I am saying everything was shut down. It was all related to money. And only a third of the community mental health centers were opened. What a great idea. Gee, how did homelessness happen? Or I came and was brought up in the project in Massachusetts. My family was the working poor. We had what was called a project. We moved out of the project. There was factory work. So there's all these reasons why there's homelessness today that there really wasn't when I was a kid. The economy, the ability to make a living and make a living for your family, so much of that's gone. So much of that's gone. And you're in one of the richest, most expensive places in the nation to live. So how do I compete? I worked here all my life. I have many people, someone working in the shipyards in Oakland, brought up his family, lost the house, lost his neighborhood, lost his life. And at 70-something years old, living in a shelter. Shame on all of us as a nation.
That was good. Yeah, that was great. That was amazing, and just powerful speaker, powerful information, and why I believe she's an expert. She doesn't want to call herself an expert, but I believe she is. At this point, during press conferences, I'd like us to break into groups. What I want us to do is, part of this public art project, is learning how to ask questions that we can then bring the expert back up and ask. A press conference has that element to it, and so whenever I'm in public space, I have my audience break into groups. We think about 3 to 4 questions as a group that we can ask our expert. We choose one and we ask our expert. We go around and we have this really beautiful conversation of what you all want to know. You've taken in information, then how do we think about what we've taken in and ask meaningful and thoughtful questions? What I want you to think about with asking questions is, I want you to uncover. I don't want you to validate, right? Uncover, not validate. What I mean by that is I want you to uncover something that you are interested in asking this expert about. I'm not validating my own beliefs or biases. I'm uncovering something that will help further a conversation, in this situation, unhoused community in the Bay Area, okay? I have these really wonderful sheets. I have about 15 of them. There's more people than I thought. But what we're going to do is we're going to break into maybe about groups of 4 or 5. It's going to take about 10 minutes or so, and maybe people can pass them around. 10 minutes to think up 4 questions. And in the end, you're going to come up with one that you want to ask. And we're going to do kind of a rapid fire segment for about 30 minutes where you're going to ask these questions. And this expert's going to give you information. So, on that sheet, it has the point in time information for the County of Alameda in San Francisco. And it also has like a brief bio about my mom. So I know like we can break into like kind of bigger groups. This is gonna be a little challenging because there's a lot of people in the space right now. But I want you to connect with each other, and I expect 4 questions. Think big and then narrow it down to 1 question. Does that make sense? I'll give you like 10 minutes to do it. What do you want to know?
A lot of information to digest.
Yeah. I love the energy, but let's come back together. In 5, 4, now be back together. 3,
Guys,
2, 1. Very nice, very nice. I appreciate that, I really do. Okay, this is where we get to ask our own questions, our own personal questions, our own, thoughts and something we've been thinking about. This is really the part of the project and the part of the press conference that I think gets really interesting. Not to say that it wasn't before, but this is where we get to really dive deeper and really start to think about what we care about and what we're thinking about. Mom, if you don't mind coming up here, you're gonna stand here. And as I said, each of you are gonna pick a question. Each group will have 1 question. We'll kind of go around. I'll bring the microphone over and you can ask that question. We're gonna start with Eric as the first question, and then if you don't mind sitting behind the podium, that'd be great. And then we bring the microphone over to Eric.
Hello. Thank you very much for sharing your knowledge with us. While you were talking, I kept thinking about my experience as a student. And I know for many of you, you're only here for 4 years. You might live someplace else and you're going to go back home. So if this isn't my hometown, why should I care about what's happening here?
Ooh, good question. I don't know. I think one of the, and I'm not sure I'm going to answer your question. I think for me, at 70, it's unbelievably exciting to see young people that are taking time out of their lives to be here. You could have bombed, you could have called in sick, you could have told Chris, hey, I tried to make it, but I didn't get a seat, but you're here. And you're here because you care. And you're the next generation, no matter where you land, whether it's here, whether it's back in the Northeast, no matter where you land, in the United States anyway, you're the next generation of caring, system-changing generation. So right off the bat, someone like me, are handing the baton of responsibility and of advocacy and of caring to each one of you in whatever way you can make a difference. Whether it's in the Northeast, whether it's here, no matter where it is, there are people in need. One of the things I didn't mention was the percentage of people that are disabled in the point in time. And a disability is mental health, right? A disability is chronic substance use. No one wants to hear that. Let's blame those bad people that are shooting up. There's usually a reason why. Cognitive disabilities, developmental disabilities, chronic health conditions. So people that are disabled, it's okay, our society says, to live on the street. So again, no matter where you go back to, when your 4 years are up, you can make a difference in whatever way. And secondly, and I was thinking of this, art and music to me reaches people's souls. I'll meet a lot of people. I met someone yesterday that was working on something. And the minute he heard, whenever I tell people I love to see, I work with the homeless, how could you do that? Oh, I went into an SRO and they trashed it, blah, 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 and they don't want that unit, blah, 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 blah. I'm not going to sit and debate that person. I'm not going to sit and debate, and hopefully they'll have experiences so they'll change their tune, right? But you're in the land of art and music where you're touching people's hearts. My words only touch up here. This stuff, this is good for toilet paper, right? It is. But you have the ability to touch people's hearts and souls. So whatever you want to work on in the next 4 years and for the rest of your lives, as artists, you have the ability to touch people. And it's going to open up their thinking. And you're going to do it in a way that, I didn't know that. It's sort of educating, right? It's sort of telling the story of people that we're too scared to hang around. And it's like, oh, you have such power. And I hope each one of you realizes that no matter where you choose to make a difference in whatever society you live in, you have a lot of power.
Yeah. Hell yeah, that was great. That was really good. I wasn't sure where it was going at first, but that was really good. Okay, I'm going to walk around, and then does this group have a question they were thinking about that they want to share?
Okay, so I guess a question that we were talking about was like knowing our adolescences and then like knowing the knowledge that we know now after observing the presentation. What can we do to contribute to the problem, to the change?
So absolutely. First, you got to be comfortable. I mean, you know, I was poor growing up as a kid. I mean, poor, but still get out of the projects. Thank God we were there. If the projects weren't there, we would have been homeless as a family. Okay. So all that being said, but we were able to get out of the projects. We were able to, you know, get factory work, move up as a family. I'm getting to my point because I know Chris always says, "Oh, you're off on a tangent." I think work from where you're at. You got for 4 years. What are the projects you're going to work on? There are so many social injustices and needs in the community. You know, how do you focus on that? How do you educate? How do you, and I've seen this like in nonprofits, the nonprofits I worked for, having these little postcards of, hey, gee, I didn't know that, just a few stats, wherever you choose with the work that you're doing, make a difference with it. Make a difference with it. So I see that, and a lot of it is educating good people that are busy with their lives, that have pre-misconceptions, as did and do I, and just educating in a very gentle way with the heart.
Okay, that was good. I think one thing I want to ask, and that was a really good question. I remember when you were working at the shelters in San Francisco, you were constantly looking for socks, I recall. I remember, weren't you going to U-Haul for blankets because you didn't have enough money to so why these are things that people can donate, could give, even like some things that we could, beyond I love the inspirational talk, but something that we could actually physically give, or like donate, or
So definitely I think, you know, any kind of the basic needs. So again, not just around the holidays, socks, towels are a big thing. Definitely I was going to U-Haul because we didn't have enough money for blankets. I think even more than that, put yourself in a situation to get to know people. Homeless are me, homeless are you, the homeless are all of us. And for me, the journey, the privilege, the honor has been to get to know people that I couldn't do any better than they could do, that have survived domestic violence and no family and all sorts of stuff. So in some way, thinking about volunteering if you're that courageous, right? Volunteering, a group of you going in and volunteer, serve a meal, that's always really cool because everyone likes food, right? Another way, or take up donations, or do a project.
Yeah, I love all those. That's great. I'm going to come right over here. Did we have a question? Yeah, please.
I think our question was sort of like, what do you at all focus on the more political sides of it, like working to like lobby to decriminalize homelessness in general, or working with like NEDA's offices and trying to make a change in that aspect?
So shame on me. And I was thinking again, I go back to the ball in the mouth. You know, adults have peer pressure just like young people have peer pressure. So me, early in my years, oh, I'm wonderful. I'm working in a shelter. Oh, I'm doing everything that's needed. But it took many, many years for me to open my big mouth, for me to do what I'm doing here, because I'm touching on the political. I'm telling you that to end homelessness is a home. It's not ending someone's substance use. It's not getting them to be physically healthy again. It's not any of that. It's a home. And shame on me that I was always on the fringes of it. And it was always, you know, my generation was speak and not heard, and we won't get into my excuses why, and it's only been recently that I will tell the truth and tell what I see, either in the agency I'm working in or out in the community. Was I part of advocacy groups? Yes. Was I at City Hall in San Francisco with masters of advocacy that would go in at the Board of Supervisors supplemental and beg for the scraps at the table? Beg for the scraps at the table. Because the city's pretty damn rich. Yes. Did I align myself with other advocates? Yeah. Should I have done more? Yes. Yes. Yes.
She's being modest because she just won a really beautiful award in Berkeley for all the advocacy work she's been doing. But yeah, no, absolutely. That's a wonderful question. And yeah, I mean, it's public. Yeah, go ahead.
And there aren't enough to be able to tell the truth, right? That takes a special skill set. And how do you tell the truth logically to Board of Supervisors, Farrell, and all of them? I don't know if he's still around, because it's been 3 years, right? Because they don't want to hear it. They have constituents. Usually they're in the rich sections of town. And frankly, and I'm judging, because I'm pretty comfortable myself, they don't want to hear it. They just want people to go away so they don't have to deal with them. So how do you tell the stories? And how do you bring along the people that you're advocating to also tell the story? Yeah.
Okay, that was good. Let's keep going. Question here? Anybody? Yes. Thank you.
Hello. So I had a little bit of trouble kind of like phrasing this question, but basically you were talking about how people of color are disproportionately affected in the homeless community, and a lot of that stems from this kind of like systemic racism. And I was just wondering, because I'm not very educated in like the whole political sphere, mainly on like a San Francisco level, where in the actual like governmental body can we like pinpoint anywhere where there is actual like systemic racism, or is it more of like an overall the whole system is set up to benefit white people?
So I'm not the one to stand here and talk about racism because I'm white and I'm privileged and I've got, you know, how do I think of it? I think of it as I'm white and I have privileges that I thought everybody had. How stupid am I? I swear to God. It's like you're in an ocean and you think everyone has what you have. And then as I become educated by so many of my staff that were people of color that tolerated my ignorance, I realized, no, that's not the case. And what I take for granted, people of color have to fight for or not get at all. So in San Francisco, and I know you did a project, and again, I've been busy working with all the history piece, but in San Francisco you had the whole redevelopment, I think they called it, and I think it was the Folsom area. Folks that lived and breathed and were brought up in the city, Oakland that's happening too. Yeah. They're priced out of there, it's gentrified, and white people like me with money go in and buy the homes.
Yeah, I mean, there was redistricting in the Fillmore neighborhood in the 80s, 70s, 80s, 90s. We also see redlining, and I've talked about this in my class before, but redlining is happened in San Francisco and in Oakland as well. And this is the lack of loan or lack of access of loan money from banks specifically to people of color that could not get a loan to buy housing, right? And so this was a way to kind of change the demographics and look of a neighborhood through racist and systemic racist policies, right? So redlining was a big thing that's happened all over the country, but specifically you can map it out in Oakland, literally kind of following the BART track actually, which is kind of interesting. But yes, yeah.
You know, and I think just to give you, and this is my finally, shame on me, opening my mouth and saying things, right? And again, I can use the excuse I worked, I busted my butt, I worked or whatever. I work at a nonprofit. The nonprofit's goal is to serve folks that are homeless. I've always worked in a nonprofit, always with homelessness, and then housing, getting people housed. And yet it's only been recently I asked the hard questions. Why is it that the decision makers in my agency are white? And yet, the people that are doing the work are people of color. Why is it that the people at the lowest level in direct care of the shelter are barely making a minimum wage? We say we care about people. What is that? And yet the higher up are making, and I'm not saying it's inflated because nonprofits are supposed to be poor, but again, it's finding your voice, and that's hard to ask those questions, but not everyone wants to hear them. So again, I'm not one to stand here and talk about racism, But the facts are the facts, right here. Yeah.
Okay, thank you, Ian. Let's get a question over on this, and I'll kind of move over to this side here. Is there a question that we wanted to ask on this side? Anybody? That's fine. Anybody here? Nothing pressing on the top of the mind? Okay. Not a,
We did
Yeah.
talk a little bit
Sure.
about, I think we did talk a little bit about what it is and how difficult it is to live on the streets and the amount of pain constantly that people are experiencing living on the streets, and how there's this villainization of substance abuse,
Yeah.
but it really makes sense if you're under constant pain to, do something that's going to numb that for a little bit of time, and just thoughts on that, what it is to hold both of those, that there are substance abuse issues. But that in many ways they're understandable in those circumstances. And so I don't know if that's a question that we formulated yet,
But it's an awesome observation. And again, I think for people that don't want to maybe listen to the truth-telling, right? I mean, I wouldn't know any of this unless I, worked with the folks that I work. If you don't have mental health issues walking into homelessness, you are absolutely going to have them walking out. You're going to have post-traumatic stress disorder. Women out on the street are highly vulnerable to rape, to sexual assault, to all sorts of things. I think our society, again, we pull ourselves up by the bootstraps, right? Well, they can't, they could do it. I heard this yesterday. Well, we just, I went into a unit and the person was on drugs or whatever. Let me tell you something. I could not live in the shelters that I managed. There was no privacy. You shared stalls of maybe 10, trying to keep it clean, forget it. You had a drawer to put your life's belongings in. Homelessness is a full-time job. Homeless, especially in San Francisco, because 3 years ago, you didn't just get the bed till you get out of homeless. You had to bounce around from shelter to shelter. So San Francisco is going to make you work for that damn shelter bed, 30 inches apart, okay? You had no privacy. Your life was down to a plastic bag. So again, the trauma of homelessness, the stigma, we would see encampments come in. They at least had, which I loved at the navigation centers, the encampments would come in, they would have their leadership. They would still have enough self-respect that you're not telling me what to do. I admire that. They weren't beaten down by homelessness, because so many people are beaten down by homelessness. And the longer you're on the street, the longer it is. But the encampments I admired, because it's like, you're not telling me, I'm not doing those rules, I'm not going to eat when you tell me to eat, right? And so that's where the navigation center was born, is what are we doing? What are we doing? How are we helping people? They're just bouncing from shelter to shelter. The emotional toll, that's the word, of being homeless is immense. Is there drug use? Yes, there is. Do rich people use meth? Yes, they do. Crack? Yes, they do. Pot? Yes, they do. Yes, they do. I haven't seen a study, because I haven't come up for air to see what's the drug use among people with money versus the drug use of people that are poor. And you know what? If I was homeless for so many years, I'd be doing the same damn thing, because you're numbing yourself. You're trying to adapt, you're trying to survive, you're trying to live. And what we saw at the NAV Center, people coming in after 15, 20 years of being on the street, it was like, it takes a while to acclimate. It takes a while to, oh my God, and now I'm by myself. Somewhere along the line I've waited, I've now got a key, what do I do now? So it's a whole stigmatization. When you've got people walking by you, not even looking at you, not wanting to see you, upset because you have to use the streets and the sidewalk to defecate, but you're not giving me a porta potty to do that. What the hell do you expect? Sorry, I'm going on.
Now listen, and quickly, I'm going to go back to the questions. So I think this is a really good time to think about what harm reduction is and what the model is for San Francisco and the Bay Area. What is harm reduction, so people understand?
So when I was running the large shelters, 334 beds, right? I had 9 staff on, swing shift, I think, I don't know, less than that. So again, we're vastly outnumbered, 5 floors, right? It was great. I love this one. You know, we have 30-something rules, and in there it talked about you can't bring in drug paraphernalia. Give it a break. I mean, we're not even going to find it, thank God, let alone you can't bring it in. Navigation centers came along, and all my staff move over to the NAV center, where it's harm reduction, true harm reduction, which is using. How do we help you to reduce so that you don't kill yourself? That's harm reduction. It's not judgment. It's not harm. Some people think harm reduction is, oh, I'm going to help you to use more. No, 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 no. It's just we care about you. Number one is based on a relationship of care and love, not judgment. Not judgment. Okay, that's number one. Number two, the behaviors of drug use is not who you are. It's not who you are. And so then, and again, our society has a huge stigma around that. So harm reduction, and I'll end with this story. Dope Project in San Francisco were awesome. They trained staff because we were rigid, right? There's no using, and there's no paraphernalia, and there's no nothing. They come in and they train us. And then we started to look at the human being in front of us. And I remember one young man coming in, and it's like, you know, this is the NAV center, so less rules. And he's saying, you know, he said to one of the staff, I can't thank you enough for being here. This is so cool. I wouldn't go into a shelter because there's so many rules. I would have gotten kicked out because of my drug use. But you know, you're taking my needles, and when I gotta go out and get hit in the morning, I gotta use a dirty needle. And it's, what the hell are we doing? What are we doing? What are we doing to other human beings? And it really hit home to the point where staff that were like this were now baskets with clean needles and saline and tourniquets and cookers. And it's, we care about you where you are at. How you got here, there's probably plenty of good reason why you're using. Plenty of good reason. And how do we just keep you safe on your terms? Not on my terms, not on our terms. Because all we care about is that you're alive.
Yeah,
That makes sense?
And that's perfect. I think harm reduction is really important, and it's part of the culture in San Francisco and other cities, Seattle, New York, places like that. And it's a distinction from other places across the country. And so thank you for clarification on that. We have time for one more question. Can I get one more question here, and then we can wrap it up? Something that somebody was thinking about. Come on now, one more. Yes, of course.
If we had more resources to solve this issue, what would you implement? What would be the solutions?
Yeah.
Homes. As a kid, there were the projects, right? I lived in they call them the projects. I don't know what they call them now, right? So it's highly subsidized because we were working. My mother was at 8th grade education. She was an immigrant. My father got disabled. We needed to do the projects, right? I know that the federal government, counties can't do it by themselves. States can't do it. Again, go back to that COVID. All of a sudden, COVID. Money's being infused by the feds. Why? To get people off the street so they're not dying in droves. I will say, and again, hotly contested, that what's needed a different kind of housing. Section 8 housing, the people that are dramatically poor, especially in California, 30% of your income, you're not spending 90% of your income and you can't eat. Permanent supportive housing for the people that I work with that have mental health issues that will never, will get somewhat better when they're housed, but will be there. People are chronic health conditions, so for permanent supportive housing is for people that will need support until they transition on to independence. But housing, and housing is going to come by an infusion of money from the federal government.
But one thing I want to add on that, because that was great, is it's really hard to get housing, especially if you don't have an ID, maybe you don't have an address, right? There's different barriers to getting into permanent housing, which is really tough. And so, what was that? Yeah, totally. Sure. And think about just getting like Social Security, right? Some government benefits in this country. It's really hard, and you need certain things that for us seem so normal. A license, right? An address, things of that nature, that these become barriers for people. And so, and especially unhoused community, right? And so, absolutely, I love that you always say that. But the goal is to have a home, to get into housing in some capacity, right? Listen, we're almost running out of time here. No, wait a second. Nobody leave yet, but round of applause. That was amazing. I want to say, this is art, okay? This doesn't seem like art, but it's art. It's public art. It's bringing in knowledge, it's education. We ask questions today, and you can have a practice like this too. It's public art, and it's engaging with community, right? So think about it.
And I'll say, because I'm always going to get the last word on it. Thank you for being here. This takes courage to listen to all this because it's uncomfortable, right? And again, I can't emphasize enough, you are the next generation of caring people. Do better than what we did. Do better than what we did. Wherever you go, wherever you live, do better. Thank you.
Yeah.